Orthopedics, rotator cuff surgery. Setup is critical. Rotator cuff problems are common. In general orthopedics you see a lot. They don't all have to go to a shoulder surgeon, as the technology has improved so much that the surgery has become a lot easier. Arthroscopic techniques are available, but in my opinion they are harder and slower. I prefer a mini incision technique. Here are my tips. Use a beach chair position. Position the drapes with a pocket drape to hold the arm for you. Use a small angled retractor, so-called cerebellar retractor. My kingdom for a good retractor. Use fiber wire. It's from Arthrex for the repair, and use MyTech bony anchors or something similar. I use a mini incision approximately 2 centimeters long over the lateral acromion, but do not detach the deltoid from the acromion, but split the deltoid. Then rasp. Yes, use a coarse rasp the undersurface of the acromion to clear enough space for your repaired rotator cuff. Here's the setup. The arm is resting in the pocket of the drape. See the clear, transparent pocket? It's a really good setup. Just rests nicely there for you. I have my instrument tray over here and Mayo stand, so it's with an easy grasp, and you don't have to bother your scrub nurse all the time. The other instruments are here. Here's the assistant. The instrument tray. There's my 2 to 4 centimeter mini incision. Here's a large tear. Use fiber wire to bring it together and then anchor it to the bone with the bony anchors. Deltoid. Here's some other notes. Here's the deltoid where I detached from the deltoid earlier and it actually detached. There's a gap with puckering the skin, partially detached. Heavy smoke of the bone was very soft. Here's another case for you. Rotator cuff arthropathy. So tear of the rotator cuff, secondary OA, confirmed by ultrasound. Would you repair this cuff or replace the joint, reverse shoulder joint? Well, that's expensive technology. I'm not sure the results are so great. Many of my patients ask me to attempt to repair the cuff, which I do, and leave the glenohumeral joint as is. Here's another case of a large bald head, massive cuff tear. You can actually get these together. You take your time, mobilize, put your finger in under the acromion, around to the coracoid, back over the back of the humeral head. Free up all the adhesions. Use Alice forceps to bring it together. Use fiber wire along the longitudinal aspect of it, and then anchor it to the bone with the MyTech. No matter how massive the tear is, try to repair it. Even if you only get 40 or 45% repair, you'll still notice a big improvement for the patient. So here's a repair by a mini incision technique, and there's good results at 2 months in a 60-year-old female who had a massive tear. Again, rotator cuff arthropathy. Good range of motion, little pain, at 80-year-old. Major repair at 2 months. Case 5, a large retracted tear, mobilized, good repair. So in summary, the setup is good and critical and makes the surgery a lot easier for you. Rotator cuff arthropathy, my opinion is try to repair the cuff. Don't just rush to reverse shoulder replacement, as it's very expensive technology and I'm not sure the results are that much better. Thank you for your interest.